Hey there, Dr. J here. You can see this is sort of my rhinoceros look, but I got a little filter here when I'm seeing patients, work with them. I'm here in the clinic right now. And I wanted to just follow up a little bit on what I mentioned previously in my birthday webinar on boosting your immune system. I, like many people, are very visual, and so I like to provide a visual representation of what's going on. So here is a chart that I use. This is actually it's a bas relief. There's actually, it's actually curved. You can see sort of like it comes out from the. It's a very beautiful illustration. But we talked about the sternocleidomastoid muscle before. This muscle here, it has lots. This one here starts out with mastoid back here, comes down the clavicle. This muscle here. So I just want to show it on this chart because I think it shows it a little more clearly. It's this right here, right along here. You can see it bulges out a little bit there. And if you lean your head to the side, sometimes it is a little more prominent. And here, you can also see it attaching here to the skull. It's back behind the ear, the mastoid bone there. And all through here, in the armpits, down in the groin area in here, and all throughout the whole intestinal tract, there's lots of lymph nodes. And the lymph nodes are the areas that help clear out toxins, accumulate the toxic debris, and then move it on down close to the heart so it can get circulated and removed in the kidney. The debris, not the kidney, and the spleen, and in the liver. So that's one thing. So the sternocleidomastoid muscle, once again, remember, massage gently, squeeze, 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 squeeze. That helps to pump lymphatic drainage materials from the sinuses and the mouth region out of there. And all the respiratory viruses influence the sinuses, influence the mouth, the oral cavity, the throat. If things are moved more, then the immune system has less of a backup, less burden. So it can clear the debris out that result from the virus is coming in. The body says, hey, what's this? In the mucous membranes and stuff, it sends out immunoglobulins and other antibody reactions so that the cellular defense system can attach to it, and it can pull it away, and it can break it down and get rid of it. And that's debris. Just like if there was a tornado or a hurricane in an area you're living in, there's all this debris left, and somebody has to come in, clean it up, and that debris has to be dealt with. Well, our body does the same thing in these kind of hurricane immunological reactions. So I just want to show that to you. Also,